data. So I think the future of healthcare, and I wish I had more of this background, quite honestly, is in data analytics. I think the people in quality and in process, and again, I'm a big fan of Lean. Spent the past 7 years of my life really deploying, studying, implementing Lean, across the country in healthcare. But I think one of the deficits is that we haven't really used the data we have as well as we could. And so I would say, informatics, data analytics, real understanding of metrics and measurement, statistics, epidemiology. If I had all the money in the world, I would probably, those are the type of people I would go out and hire. And truth be told, those are the people I actually am hiring right now. So in our quality division, and I'm sharing something with you that I actually don't share with most of the organization, when I have an opportunity to hire a new person, and particularly a young person at a school, into the quality division, I'm not looking for MBAs. I'm looking for people with statistic and quant background. And because we have tons of data, it's just sitting there. And I need the expertise to go in, mine it, make sense of it, and this is today, not 5 years from now. And so one of the cool things we're doing actually at CHS, to give you a sense of this is not just my opinion, we've created a data analytics institute. We actually had one, but we decided to actually create a world-class data analytics institute, and I don't know, at this point we probably have over 100 technical people in that institute, from postdoctoral health science researchers to epidemiologists to healthcare economists, to statisticians of all sorts and sizes, and so we're really creating an army of quant, and that's what we need to do in healthcare. And if you look around the country, that's what's happening. So for me, that's again, I completely agree with what the other two folks have said. The human side cannot be underestimated. The leadership that's required, the discernment, the organizational systems thinking, the change management. There is no question, no doubt, that all the quant in the world cannot really change things without that. But from a technical perspective, it's the quant for healthcare.
Okay, I think I've seen quality make quite a journey over the last 25 or 30 years, and probably if you go back even farther than that. I guess it's gone, from my opinion, it's gone from QC to QA to QI. And I'll explain what I mean by that. I think it started out kind of quality control, little Q quality, where you're doing SPC charts and audits and root cause corrective actions and reacting to problems and all of that. And then it evolved into more of a quality assurance, where you're trying to make sure that you get it right the first time and you build it into the system. And I think it's evolved more into a quality integration role. And I think I've been involved in more weird things in quality than anything. I got to write a sustainability report. Anybody heard of one of those? About your environmental impact and your carbon footprint and all those kinds of things. I've gotten involved in lots of different things. I had the CFO of our company come ask about product liability insurance and how to reduce our rates. How can we do that? I had lots of really interesting assignments with engineering and HR, and even facilitated some policy deployment among legal professionals that one of them in the room here. But I think the big thing to me is I think it's like walking up the down escalator. And if you have the kids ever do that at the mall, they take off running and they try to beat the escalator. Quality is like that. It's changing, and it's changed a lot over time. But I think I see two areas kind of emerging that ASQ can really help us with. One is probably Mary's job. I think her title makes me jealous. I want to be the Chief Risk Manager, Chief Risk Officer, because that's what I do a lot, is risk management. And I think that's something I didn't expect to do. When you get into quality, you think you're going to do FMEAs and DOEs and all that kind of stuff. But it's not the case. You're actually teaching people how to deal with uncertainty, and how to deal with risk, and how to mitigate some of the risk away. How do you measure it? How do you mitigate it? How do you manage it? And so, if there's a way to build that into the body of knowledge and some of the training programs, maybe some cross-functional things that you might be able to do with weird groups like APICS and MAPI and other groups that are trying to struggle with the same issues, and say, how do we teach quality professionals to deal with risk? Because then they can help any part of the organization do better than they would have without them. And so the transition that I'd like to see is from that necessary cost somebody mentioned to more of a value-added, desirable skill set that everybody wants in their group helping them. The other thing I would say that quality professionals really need to understand is the integration. How do you develop the leadership models? How do you develop the capability maturity models? How do you make quality, the police force, talk to the continuous improvement folks and talk to the business people, and pull it all together into a working system. Because until you start to become a systems thinker, until you start to think how these parts interrelate and react, you really, I don't think you can get to that QI phase. So I think there's a lot of things that ASQ could do with that. I know they've done a lot. The future study is an incredible step, I think to take a look at that, try to, guess at what's going to happen and how can we get ready for that type of thing. But I think that's the thing we need to really help people understand is how do you bring it into real world systems and make them better, more robust.
Thanks for staging my answer for me, too. I think that it's such a great point, because if I were looking at the future, and I've been involved since I came to the Bank of America in 2002, which was at the beginning point of their Six Sigma journey on a big scale. I don't have that wrong, Mike.
It was 01 when you actually started. Yeah, you were right after.
Right after I got started, and everything was the quality work. It was quantified in terms of dollars, whether it was productivity, accuracy, actual savings. And that was the huge part of the work effort. It was all labeled that way. And so as the program has matured, people still think of it as that separate quality activity. I think when I think about your question on the future of this, don't call it quality. I mean, really, the project, I think we spend a lot of time calling a quality project and then figuring out how do we make people get the value add of the outcomes. When I think about the projects I've been directly involved in over the years, it was an information security project, and the absolute outcome was improved security status. It was a customer satisfaction project on improving the cycle times and the accuracy of the transaction risk and everything else, but it was customer satisfaction all the way. It's risk management now, and it's amazing how much time we spend with great quality people to look at the work they've done on a process, and we have to convince them that they can call it risk management and take absolute credit for all of the amazing control improvements they've done because of the really strong, effective quality work that they've done. So as I think about this organization, helping quality professionals understand not just the link, but the actual outcome being top of mind at all times. Don't worry about catching the value add after the fact. Make it the point of the entire work effort. Because we seem to, again, we spend a lot of time with people who are truly very focused on the quality piece, convincing them of the value add in a lot of the risk management work that we're doing right now. They're surprised when we take all the work that they did, we simply turn it 180 degrees and talk about the outcomes in a different way. We didn't add any more work to it, but the outcomes that they should have been taking credit for all along are really amazing when you just look at it with a different lens. So I think the more that this organization can put those different lenses on the quality work, and we produce more of the discussion points, and at the inception of the problem statement, we're talking much more about what the ultimate outcome will be, and keeping that top of mind. And even if it makes the quality statement secondary, it's actually okay, because the value add and the real improvement and the outcome from the improvement is top of mind for everybody you've got to sell that work to along the way. Again, we seem to do it more secondary sometimes now, and even the quality professionals have a tough time really taking credit for the entire scope of the improvement activities.
Excellent. Such a tremendous breadth in how the quality body of knowledge is being used. We're looking at new uses of old tools, new places to use tools and techniques. We're looking for new tools and new opportunities to bring things in. So I think this is tremendous, and it shows quite a bit. We have enough time for